Hello, my friends. This is Dr. Diana as patient, and I am pretty ill. Now, today is a special episode because I'm having an attack of what I believe is high intracranial pressure, and I wanted to get on while the symptoms are happening before I forget and to compare notes with all of you guys. And I really want to know if you can relate to any of these. In case it's your first time on, I had angioplasty for CCSVI about 4 or 5 months ago. I have Ehlers-Danlos syndrome and with some symptoms of multiple sclerosis, which, by the way, my scan came back and I do have one brain lesion. So anyway, something really bad is happening today, and it's kind of hard to explain, but I think there's some people out there who will understand what these are, and I hope that these pass like they usually do. But when I woke up today, I was really, really dizzy, and I noticed that it's been kind of creeping up on me, but I was trying hard to ignore it like we usually do. We try to work through these sort of things. But today it was, whoa, really bad. And when I was getting dressed, because I really wanted to address you guys, I realized that my left hip was numb again for the first time since the angioplasty, which really was kind of a bummer. And then my tongue, the front half or so is like numbish, tingly, tastes funny, and very difficult to describe, but haven't had that in a long time, which is a bummer. Now, my distance vision is blurred. My husband looked in my eyes just a few minutes ago. Everything looks okay. The optic disc isn't swollen or what have you. So we'll keep checking into that. I have got clear fluid running from my nose, which, especially if I lean forward, I'm sure it's CSF, cerebral spinal fluid. I need somebody to help me figure that out. But I have this incredible sense of fullness in my head, especially up on top. It feels like pressure. It's not exactly a headache, but it's something you're very aware of. My eardrums ache, and they just plain hurt. And they're squishy. I want to know if you can hear the eustachian tubes squish. My son complains of the same thing. I don't know if that came out, but we'll see. But other people can hear it too. It usually only happens when the Diamox wears off. But my neck aches. I'm nauseous. I was cold when I first got here, and now I'm like clammy and kind of sweaty. Sort of how you feel if you have the flu, like right before you get sick. And trust me, if this video is on, I didn't get sick, or I would have stopped. But my right arm and leg are like they're kind of dragging around again. The tremor on my right hand is worse. The clonus, what I think is clonus on my right foot, is worse. A couple of days ago, I had some really weird visual symptoms. I looked down at the car radio and it looked like it was moving away from me, which I know, understanding how depth perception works, that's one of the cranial nerves that controls the eye movements, either 3, 4, or 6. And if you have partial paralysis of one of those, it moves an image in one eye or the other, and it makes things look like it's coming from a different depth. But it wasn't a stroke because it went away. So amazingly, they say when you look up those nerves that multiple sclerosis can cause that sort of thing. Ditto with one day I woke up and not only felt dizzy, I was a little bit dehydrated, but I actually had nystagmus, and that's where your eyes slowly go to one direction, they jerk back. Lying on my right side, the quick cycle was to the right, and lying on my left side, the quick cycle was to the left. And as an eye doctor, I just sat there kind of puzzled with that. But because it was temporary, a temporary horizontal nystagmus is probably fourth nerve damage, the trochlear nerve, and multiple sclerosis patients can also have nystagmus. But again, this went away in a few hours. Now, what I'm experiencing, I think for sure, is cerebral spinal fluid pressure that's too high. Now, is it related to restenosis? I don't know. See, I need to get the cerebral spinal fluid into my veins, and I need to keep my veins open and draining. Both mechanisms must work in order for me to stay with fewer symptoms. I've never been symptom-free, but in order to be somewhat functional, I've got to have both of those things working. So I'm going to check and see if I'm restenosing. I took some extra Diamox, but again, I'm kind of acidic, and so when you become acidic, the Diamox stops working. So I've got to really work on figuring out how to get more alkaline. I stood up. hung my head upside down because I want to protect my brain. I want to try to protect the cranial nerves. I took a Sudafed to try to increase the arterial pressure, to push oxygenated blood into my brain, if you will, and into my skull. I don't know that that's going to work. So far, I haven't really noticed any difference. But I must figure this out. So curious if you guys with MS, multiple sclerosis, or both experience this sort of thing. I haven't had this happen in a long, long time. But when it does happen, boy, it's bad, guys. So I look great today because it wasn't quite full blown until I actually got here. But I was able to get dressed, etc. But yeah, I think I'm going to go lie down and see if I can get some of the pressure down, and I'll get back with you hopefully later today. Would be great. Thanks. Bye.